Good day, everyone, and welcome to today's webinar on the significant changes to Medicare coming in 2025. My name is Andy Firmin with Benefit Advisors Group, and I'm here to guide you through the updates that could impact your Medicare planning, especially in terms of prescription drug costs. The goal of this presentation is to educate you so that you have a plan for annual enrollment. All Medicare recipients should have a trained, licensed independent agent that is knowledgeable about prescription drug plans and has advanced training in drug saving strategies to help you navigate the complexities of prescription drug plans. In August of 2022, the Inflation Reduction Act was signed into law, and it brought several crucial changes aimed at lowering prescription drug costs for Americans. Today, we will focus on the key changes to Medicare that will take effect in 2025, including the new $2,000 out-of-pocket cap for prescription drugs, the Medicare prescription payment plan, as well as adjustments in cost sharing. Before doing so, to help put the changes into context, I think it is first helpful to understand the history of Medicare prescription drug coverage. We will then review a comparison of prescription drug coverage as it is today relative to the changes being introduced in January 25. We will then review the cost sharing and why this matters to you, the Medicare beneficiary. And lastly, we will touch on the new Medicare prescription payment plan, which is affectionately being called MP3 for short. Medicare's prescription drug coverage has evolved significantly since its inception, with major milestones including the introduction of Part D coverage in 2006 and ongoing reforms aimed at reducing the financial burden of prescription drugs for beneficiaries. In the 2025 changes under the Inflation Reduction Act represent the latest in a series of efforts to improve the affordability and predictability of prescription drug costs. The Medicare Modernization Act of 2003 created optional prescription drug plans for those on Medicare starting in the 2006 plan year. And the program has largely been unchanged since its introduction 18 years ago. The Inflation Reduction Act of 2022 will introduce perhaps the most significant changes in Medicare since the prescription drug plans were introduced back in 2006. First, starting in 2023, the Inflation Reduction Act capped insulin at $35 per month. And then in 2024, the 5% cost sharing the catastrophic phase was eliminated. Now, beginning in 2025, the coverage gap, or what we commonly know as the donut hole, will be eliminated. Instead, there is a $2,000 cap on out-of-pocket cost on prescription drug costs. Additionally, for those with expensive drugs, a prescription drug payment plan is being introduced. And lastly, starting in the 2026 year, provisions of the Inflation Reduction Act will now allow the federal government to negotiate prescription drug prices. Let's first take a look at the current prescription drug coverage and compare that to the coverage in the new 2025 plan year. Whether you have a standalone Part D prescription drug plan or prescription drug coverage under a Medicare Advantage plan, these coverage phases are the same. Currently in 2024, there are 4 stages. First, the deductible stage. If your prescription has a deductible, you must satisfy that deductible before your insurance plan will pay for prescriptions. Once you satisfy that deductible, you enter the initial coverage stage. Here you may pay a copay, a set dollar amount for your prescriptions, or coinsurance, which is a percentage of the cost. Now you stay in this initial coverage stage until you and the insurance company, your insurance plan, pay $5,030 for your prescriptions. At this point, you enter what is known as the coverage gap, or what is commonly referred to as the donut hole. At this point, you may have to pay 25% of the retail cost of your prescriptions, and you continue doing so until you and the insurance company pay a combined $8,000. At this point, you enter the catastrophic phase and will no longer have to make a payment for your prescriptions. Now, starting in 2025, there's going to be a $2,000 maximum amount on what you, the Medicare beneficiary, will pay out of pocket for your prescription drugs. This cap eliminates the donut hole. So in 2025, prescription drug coverage will still have the deductible stage. If your prescription has a deductible, you will need to pay that deductible before your plan covers the prescriptions. And once you satisfy the deductible, you will then enter the initial coverage stage. While you are in the initial coverage stage, you may have a copay or coinsurance at the pharmacy for your prescriptions. But once you have paid a total of $2,000 out of pocket for your prescriptions, you will enter the catastrophic phase and will no longer need to make payments for your prescriptions. So for those who are currently entering the donut hole, this change is going to save them a lot of money. However, only 10 to 11% of the Medicare population enters this coverage gap. Now, for that 10 or 11% of the population, they may be spending $3,000, $4,000, $5,000 or more in copays at the pharmacy. Now, next year, they will max out at $2,000. This is a very positive change for those folks, and those folks need this help. However, if someone is currently spending $6,000 in copays at the pharmacy, and next year they will only spend $2,000, who is going to make up the lost $4,000? Let's take a look at the next slide that walks through the current cost sharing of prescription drug costs and compares that to the cost sharing in 2025. Medicare prescription drug costs are shared among several parties: you, the Medicare beneficiary, the federal government, Medicare, the insurance company, and the drug manufacturers. This chart shows a breakdown of who pays what percentage under the different phases of Medicare Part D prescription drug coverage. The pinkish coral color is you, the Medicare beneficiary. The dark blue is the insurance company. The light blue is the pharmaceutical company. And the green is the federal government. You can see that for both 2024 and 2025, you, the Medicare beneficiary, is paying 100% of the cost while in the deductible phase. There's no change here. And currently in the initial coverage phase, the Medicare beneficiary, you, pay about 25% of the cost through copays and coinsurance, and the insurance company currently covers the other 75%. Next year, the insurance company's cost goes down to slightly about 65%, and the drug manufacturer will cover the remaining 10%. Now, this is where things start to get interesting. Currently, if you enter the donut hole, you are paying 25% of the cost. The insurance company is only paying 5%, and the drug manufacturer is picking up the remaining 70%. However, starting in 2025, with the elimination of the donut hole, the insurance company's cost share is increasing to 60%. That is a massive increase, and one the insurance companies are likely not going to absorb by themselves. This is why it's important to be aware of these changes. Now, I mentioned earlier that only about 10 to 11% of Medicare beneficiaries ever reach the coverage gap or donut hole. So the question becomes, if the insurance company currently pays about 35% of the prescription drug costs, and in 2025, that is going to increase to approximately 60%, who is going to cover that increase? As we can see in this chart, it's not going to be the federal government, and it's not going to be the pharmaceutical companies. Their costs are both going down. So if we just saw in the previous slide that the insurance companies' costs are significantly increasing and the cost for the government and pharmaceutical companies are going down, why does this matter to you, the Medicare beneficiary? Well, unless anyone believes the insurance companies are going to absorb a 30+% increase in cost, somebody has to help absorb that cost. And that someone may very likely be the other 90% of the people who never enter the coverage gap or the donut hole. How can the insurance company pass along the increase? The levers they have available to them are increased premiums, increased copays, coinsurance, and deductibles. The insurance company can also use their formulary or the list of covered prescriptions to help contain their cost, which means your prescriptions may no longer be covered, or the insurance companies may introduce additional utilization tools on your prescriptions. Since the insurance companies' costs are increasing, it has forced insurance companies to review their plans and profitability. And for those plans that were operating on thin profits, thin margins, the insurance company may stop offering that plan. We already know that WellCare will no longer offer Medicare Advantage plans in Massachusetts, New Hampshire, Rhode Island, and a few other states. And we know Mutual of Omaha has exited the prescription drug market. And we anticipate there will be others. This means members in those plans will need to enroll in a new plan, and if they don't, they may find themselves without coverage come January. Now, one obvious tool for the insurance companies to use in passing along their increased costs to you, the Medicare beneficiary, is to raise premiums. Keep in mind, the Inflation Reduction Act was passed in August of 2022. So the insurance companies have had time to prepare for this and they saw this coming. And from 2023 to 2024, we did in fact see significant price increases in standalone prescription drug premiums. It has been widely thought that we'd see significant increases again for the 2025 plan year. However, in the last few weeks, the federal government has announced some relief for the insurance companies. However, we won't likely know what the potential increases may be until October 1st. We may also see higher deductibles, increased copays, and additional coinsurance built into prescription drug plans. I already mentioned fewer plan choices. It is going to be really important for you to pay attention to your plan's annual notice of change, or ANOC, this fall. The ANOC is information your prescription drug plan or your Medicare Advantage plan sends to you every fall with the changes for your coverage. Especially if your plan will no longer be available, it's going to be on your responsibility to go out and find a new plan. You may not automatically be placed on a new plan. And if you are, that new plan may not be the most desirable nor affordable plan for you. Okay, so the insurance companies can also budget their expenses through their formulary. The formulary is just a big fancy word for a list of covered prescriptions. Now, Medicare requires all plans to offer at least 2 prescriptions in each of the 6 categories listed on your screen. Each insurance company decides which 2, and the insurance company can decide to cover more than 2 if they want to. But if the insurance company is currently covering more than 2 today, moving forward in 2025 to help contain their costs, they may eliminate coverage for some of those prescriptions. And if you have that plan and your prescription is on the list of the formulary this year, if it's removed for next year, if you don't check your prescriptions during the annual enrollment period, you may not have coverage for that prescription in 2025. Your chance to review that and to make any necessary plan changes is during the annual enrollment period from October 15th through December 7th. It is going to be very important this year for you to review your coverage during the annual enrollment period. Seek assistance, reach out, use Medicare.gov tools, reach out to an independent broker. The plan that is most suitable for your friend or family member may not be the best plan for you. The other way the insurance company can manage their cost is through utilization tools such as prior authorizations, step therapy, and quantity limits. A prior authorization means your doctor needs to file paperwork and documentation justifying your need for that particular prescription, which the insurance company will review and they may approve or deny paying that prescription. The insurance company may have a process called step therapy. Step therapy is the process in which the insurance company may require you to first take a different prescription before they pay for the one your doctor has prescribed. Additionally, the insurance companies may introduce increased quantity limits, which may restrict how many pills you can get during a set period of time. Now, the other big change in 2025 is the introduction of the Medicare Prescription Payment Plan. The introduction of this prescription payment plan begins in 2025, and all prescription drug plans, whether it's a standalone Part D plan or coverage through a Medicare Advantage plan, will have to provide optional programs to smooth out the prescription drug costs throughout the year. The prescription payment plan is voluntary, and members need to opt into it if they want to participate. If you opt in, Instead of paying your copay, deductible, or coinsurance at the pharmacy, you will instead pay it directly to your insurance company through equal monthly installments. Now, this may be a good program for those who might have high deductibles early in the year, or those who know at the time of enrollment that you may hit the $2,000 out-of-pocket max. You can either opt into the program when you first enroll in the plan or at any time throughout the year. Thank you for joining me today for this important update to 2025 Medicare plans. As you prepare for the upcoming changes, it's important to stay informed and make decisions that align with your healthcare needs and your budget. Consider discussing the new payment plan with your independent Medicare broker to see how it fits with your overall healthcare strategy. Anticipate your needs and review your plan for 2025. Book an appointment with your independent Medicare broker today for some point in mid to late October or early November. Keep in mind, there's going to be a lot of information coming your way as we approach the annual enrollment period. Additionally, this is a presidential election year, which means there's going to be additional noise regarding the presidential election. You have from October 15th through December 7th to review your plans for next year, and that's your only opportunity to make a change if you want to or if you need to. So it's going to be very important to pay attention this year. Until next time, be well and be healthy. Thank you.